The first was about 20 years ago when I saw my brother. He was training, and I had just recently sort of gotten over an injury, so I had to leave football. But I wanted to be around athletes, and I wanted to help, and I wanted to work with people. So that was the first gateway into health and fitness. The second was when I had a chance to meet and work with Dr. Han, and he'd give me a much different and broader scope in terms of approaching health and wellness and fitness. It opened my eyes to a different approach in how to work with people. So the first one was 20 years ago, and the second one was which kind of took off in a different direction, was about 4 years ago.
I think a lot of us that get into this field have had some type of injury or some type of experience where it's helped us. So for me personally, I was a competitive athlete, just like Coach, and went through my share of injuries. And as I went through my injuries and rehab and got back to where I wanted to be, I figured it would be a good field for me to pursue, so I could help others do the same thing.
The most challenging part of training is being patient, I think.
That was my answer.
What is it?
All right, go ahead.
This is really but to not be impatient, you have to have a much bigger, a broader perspective in terms of what it is that you want to accomplish with the person, whether it be an athlete or just an everyday person, because you want so much for them, you know. So the challenge isn't necessarily them. The challenge is actually yourself. Just staying patient and staying with the plan. I think the most rewarding part is probably on the opposite side of that, is when you actually start making progress and you start getting to those places that you set out to with them, and you see the happiness that they have and things that they're able to do that they weren't able to do before.
Those are very similar to, I would say my answers are, regardless if it's a fitness performance side or the rehab side, I think we're so invested in our clients that we want them to get better faster, but also we have to understand that things don't happen overnight. And for us to be patient with the process and then making sure that the client or the patient is on board with that plan, because that is ultimately how they're going to get better. And the rewarding part is that they get better. And for those that felt they would never be able to accomplish a certain task, we want them to obviously get to that level, but beyond that. So when we can make that a revelation for them and actual something they can reach, that is the most rewarding part, seeing their smiles on their faces and stuff. It's pretty cool.
My number one piece of advice, I think if you'd asked me 5 years ago, it would have been a lot different. But to be perfectly honest with you, it's just start. Just start. It doesn't matter what it is that you do. Just start. Sometimes people don't move until they have the whole plan laid out in front of them. It's going to be this and this and this. Just start. And if you start on a Monday and then your plan was to go 3 days a week and you've only done that Monday, guess what? Just start again. Just start again. And as you keep doing that, and as you keep putting one foot in front of the other, it'll start to fall into place more and more and more. So just start from wherever you're at.
Yeah, going along those lines, you have to start. You have to do something. If you don't do anything, you're not going to get any better at whatever it is. And to add on top of that is to keep moving, especially with those with injuries. I'm not saying if you fracture your ankle, I'm going to have you start jumping on it, but we have to get the parts that are able to moving as quickly as possible. So you don't get deconditioned, but it starts the process of healing. Our bodies are made of bones, muscles, ligaments, all things that help with movement. So just move.